Hi everyone, my name is Julia, and I'll be doing your case study for the week on Hemophelia A. A 94-year-old Caucasian man presented to our hospital with extensive bleeding from his oral cavity and diffuse bruising. His medical history included severe dementia and hypertension. Our patient had a habit of repeatedly biting his tongue. This led to profuse bleeding from the dorsal surface of his tongue that was persistent despite surgical placement of sutures in the tongue and removal of his teeth. His hemostasis was previously normal, and he did not take any anticoagulants or nonsteroidal anti-inflammatory drugs. There was no nose bleeding, hematuria, bloody stool, or accompanying hemoptysis. Our patient did not have any family history of bleeding disorders. On examination, his vital signs were stable and he was afebrile. There was profuse bleeding from the tongue with the presence of multiple clots in the oral cavity. No other bruising or active bleeding was noticed, except extensive bruising over his upper extremities and the presence of a hematoma on the left hand with active oozing. Laboratory tests revealed a white blood cell count of 9,500 cells per microliter, with an initial hemoglobin level of 11.7 grams per deciliter and a platelet count of 149,000 cells per microliter. Coagulation studies revealed a normal prothrombin time and international normalized ratio, and a prolonged activated partial thromboplastin time of 73 seconds. The presence of an inhibitor of coagulation was diagnosed via prolonged activated partial thromboplastin time and a mixing study that did not correct with the addition of normal plasma. Quantitative assays revealed a reduced level of factor VIII activity and the presence of factor VIII inhibitor measured at 7 Bethesda units in the serum. Our patient was not intubated for airway protection based on the wishes of his family. In total, 2 units of fresh frozen plasma and 8 units of packed red blood cells were transfused, and 3 doses of recombinant human factor VIII were given to our patient as initial management.